Hello there, everybody. Warm welcome back to everybody joining us for the final session on day one of our 7th annual ISNTD Festival. It's been quite an amazing journey today. We started with the WHO's actual kind of communications perspectives in terms of getting close to the community itself and the kind of future in terms of formats, platforms, production values, all of that kind of stuff, and from their kind of perspective, in line with their control and elimination targets. Fascinating discussion. We went through into films within communities with the Medicines for Malaria Ventures, also with the DNDi, and other kind of inputs into that particular session. We had an amazing session looking at the way creative approaches are being used, and one of those was an AI-generated avatar for use within dengue settings by Takeda Pharmaceuticals. It's caused a lot of questions and a lot of interesting thoughts. An animation by Valneva for chikungunya, kind of future-facing approach, and another community approach by the DNDi for leishmaniasis. We had a session just now on apps, actually, which is absolutely fascinating in terms of enhancing citizen science through technology. It's really a revolution that we're talking about, right? And so we wanted to end today with this session. It's a neat segue into kind of creating, how to put it, interfaces between those various audiences, those who were once neglected communities in certain settings, those audiences, and the users' data in these NGD settings and global health settings. So creating interfaces, that's what this session's all about. I'm very honored to be joined by Dr. Austin Wilson, the Director of Global Dengue, the brand team at the Vaccine Business Unit in Takeda. We're joined also by Dr. Anna Mantsoki of the FIND PDP, one of the most successful PDPs, certainly in diagnostics in the world. We're also joined by Mrs. Jessica Ahedor-Kyei, founder and CEO of Science Journalism Ghana, who's come in and out. I think she'll be joining us again. And also all the way from Sri Lanka, we've got the Ministry of Health in terms of the National Dengue Control Unit. We're joined by Dr. Lahiru Kodituwakku and also Dr. Jagath Amarasekera later on in the Q&A. So thank you all very much for joining us. I think that's enough from me, and we'll pass to the floor to the first speaker. The running order we have is Dr. Austin Wilson from Takeda, speaking about a very interesting website they've got in terms of No Dengue, that's what it's called, No Dengue website and experience. So Austin, over to you. And if I could ask the other speakers just to put the cameras off on the top of the screen. There's a button, and the microphones, and that'll be perfect. Thank you very much. Before I disappear, shout out to the audience. If you could, possibly, it's the last session, so just give your name, organization, country. That would be beautiful, and have your questions ready, formulating. We're going to have an in-depth Q&A at the end. Over to you, Austin. All right, thank you.
Thank you very much, Cameron. Hello, everybody. I'd just like to thank you, Cameron, and the ISNTD organization for inviting to share our ideas today. I'll be speaking about a consumer dengue disease awareness website, which is called www.nodengue.com. Earlier today, my colleagues from Thailand were introducing the avatar that Cameron had been speaking about, called Ingmar. And part of the Ingmar campaign is really to drive disease awareness or elevate disease awareness around dengue. Some interesting facts that were presented as well was that, especially in endemic settings, the knowledge of dengue itself is very low compared to the awareness of dengue, which is very high. When you move to travel settings, both knowledge and awareness of dengue is very low. So nodengue.com is our attempt to be able to fill that knowledge gap and to bring more awareness and knowledge around dengue. So what is dengue? It's a disease awareness initiative. It's really designed for consumers, both in endemic and travel settings, to find credible educational information which will help them understand and prioritize dengue prevention. We're looking to be able to provide reliable information. We're looking to be able to have a one-stop shop for everything dengue, including shareable articles, interactive quizzes, and prevalence maps, where we're trying to really raise that awareness of dengue risk and motivate consumers in endemic and travel settings to really seek advice from their HCPs about prioritizing dengue prevention. And really that will then start to support a community of engaged consumers through sharing of the content on our No Dengue website. So we're trying to encourage consultation and having informed discussions with healthcare professionals about dengue. We want to be able to allow our consumers to understand common symptoms and the prevalence of dengue. We want to be able to add additional resources around information and education around dengue disease and prevention, and really have confidence then to be able to have those informed discussions with the healthcare professionals. And the audience that obviously is aimed at is a very large audience. We're seeing dengue extending into 128 countries now, really looking at half the world's population of 4 billion that are at risk at dengue fever. So being able to provide information and education around dengue is really important in order for consumers to be able to think about and prioritize their dengue prevention. So what is nodengue.com? And I'd encourage all of the participants in today's webinar to be able to either take their laptop or their cell phone and type in the URL www.nodengue.com. It is a responsive website, so you're able to access it either through your cell phone, illustrated on the left-hand side, as well as the desktop, which is illustrated on the right-hand side. Both of these experiences enable the visitor to be able to search very quickly for the information that they are actually looking for through a search bar. The website itself contains 3 essential features. One is that extensive library of shareable articles in bite-sized pieces that's been written for consumption by consumers. So easy language, descriptive language around dengue fever in a number of themes or topics. There is a Know the Symptoms feature, which describes the symptoms of dengue in an interactive quiz that consumers can test their own knowledge of the types of symptoms that are presented through dengue. And then finally, there is a Know the Numbers feature, which is an interactive map taking a retrospective look at case counts over the years in many of the dengue endemic markets that our consumers reside in. And we'll have a look at all of those features through the presentation. So first, let's have a look at Know the Symptoms. So Know the Symptoms, there are 10 fictional characters placed in different settings, different backgrounds, both educationally, both socio and economically, with a narrative around these fictional patients. As the consumer reads the particular symptoms that are being displayed, through being able to click on these heat buttons that you see with a plus sign in, there are different presentations of the symptoms that the consumer can consider. With a question, do you think Juan, in this particular case, has dengue? a yes or a no, then enables us to see with those types of symptoms and the presentation of these symptoms, whether Juan actually does have dengue or not. This is not intended to provide medical advice or any consultation. It is simply an interactive quiz to bring to the fore the types of symptoms that are presented when these fictional patients present the symptoms. We always encourage our consumers to consult with the healthcare professional providers so they can get better advice around dengue. Looking at Know the Numbers, so this is the interactive map that is illustrating previous case counts in different countries and areas of the world. So there is an interactive map to start with that you can look at either Asian or Asia Pacific regions, or in terms of the Americas. Tapping into each one of these areas then allows the consumers to be able to select specific particular countries. Selecting a country will take you to the particular country of concern, where there is a slider that will enable the consumer to investigate in previous years what the case counts of dengue was in the particular country. We also provide environmental details as well, so that the relationship between weather and dengue can also be seen in terms of those environmental and weather details that we're presenting as well. So this gives the consumer an idea of how dengue has presented itself in terms of cases over the years and how those different year counts change from year to year. We also have a wealth of articles within Know Dengue. The articles have a number of topics and themes, whether it is prevalence, whether it is symptoms, whether it is talking about am I going to be immune, in particular if I'm in endemic areas. It talks about the dengue mosquito, Aedes aegypti, and other particular topics. Each of these topics are 250 words, so bite-sized pieces that can be consumed very easily. And each topic is also shareable within the consumer's own social media channels. So we talked about the opportunity of being able to share information about dengue within the consumer's own peer groups, whether that's family or friends, to be able to introduce the idea of the dengue topics to their peers as well. Over and above that, we have not only a global site, but our areas and countries themselves are also localizing in local language. So here you can see a couple of examples of localizations in Malaysia and Singapore, as well as in Brazil and Indonesia. So our local markets are able to provide local information and education in local language to consumers in those particular markets as well. Talking about socializing and sharing information in particular with family, friends, and wider groups, the Know Dengue website has companion social media pages as well. What we're illustrating here is the Facebook page. So if you go to your own Facebook channel and you search for knowdengue.com, I'd encourage you to visit and have a look and follow if you're interested in doing that. You can see to the right of the page, the amount of different posts that we are on a daily basis posting around all aspects of dengue as well. So again, very easy to consume information, understand information, and use that information when you're having consultative visits to your healthcare professional as well. We also have a Instagram page working in very similar fashion to the Facebook page. So whichever is your preferred channel, there is an option for you to get bite-sized information from No Dengue channels. We also help our consumers find nodengue.com by introducing display advertising in various areas and publications that our consumers are interested in. We also are very active in our social channels as well. So far, we've launched our dengue website, nodengue.com, at the end of last year. We've already reached and have participating visitors in a global audience of over 60 countries with 5,000 visits since launch. The map is really illustrating both where our visitors are coming from and the amount of visitors. So you can see that there is visitors coming from our Southeast Asia endemic areas. We have plenty of traveling visitors to endemic in Europe and also our endemic regions, in particular in Latin America. There are 195 posts already published in our Facebook and Instagram pages with over 5,000 impressions and 663 engagements from those visitors to our channels as well. So we are building that engaged, socially active group of interested people around dengue as well. We also provide signposting to No Dengue through different supporting campaign materials. So on the left-hand side, this is an in-office healthcare professional patient leaflet, which describes dengue symptoms and what happens around dengue, and also a signpost using a QR code, which will take you to nodengue.com. And we also have our campaign, #DengueIsHere, and video assets to really enhance and amplify the idea of gaining information and education around dengue as well. So with that, I'd like to thank you for allowing me to share nodengue.com and our social channels with you. And I'll pause there for the next presenter to present and share their ideas as well.
Brilliant. Thank you very, very much, Austin, for that. Fascinating to see this social-aware approach that you're taking in terms of a very immersive experience. And you mentioned different platforms there. I'm sure this will come up in the Q&A because we were discussing long and short formats at film level, but then also beyond that, you know, in terms of other platforms such as TikTok, what are the kind of platforms of the future that people are going to push an omni-channel move towards? And when you're trying to have cohesion between the user and driving usage and getting them immersed, maybe is that a good idea or not? So lots of room for thought. People already said great presentation. Dr. Valdemiro Escola has joined us. Thank you for the smart presentation from the Maheka Health Research Center, Mozambique. We've got Dr. Ivana Balta from Paris. Mentioning overlaps, global. You mentioned something earlier in terms of your global, the global warming, or at least the weather in those regions as well. So lots of food for thought. And I think a lot of that will come out in the Q&A. So we'd like to thank you for that. Thanks a lot. That was wonderful. And it really complements, I think, what we heard earlier from Takeda as well in terms of this AI approach as well. So thank you very much for that. I think we'll move to the next speaker, if that's okay. And we have with us, we're honored to be joined by Dr. Anna Mantsoki from the FIND PDP in Geneva.
Thank you so much for giving me the opportunity to present to you today. Excellent initiative and a very good presentation on dengue, no dengue so far. So I hope I keep up the momentum. So my name is Anna Mantsoki. I'm a senior data scientist at FIND. Today I will talk to you about the DxConnect test directories. Which we believe, and we're very proud at FIND, we believe they're a beacon of information in, a sea of questions that come up usually in the DX arena. So I will give you a short introduction of FIND. I'm sure many of you know FIND. We are an PDP established in 2003. We seek to ensure equitable access to reliable diagnosis with connecting various stakeholders across the life cycle and the DX R&D development chain. Our headquarters are based in Geneva, Switzerland, but we also have offices around the world, namely in South Africa, Kenya, India, and Vietnam. We have a lot of experience, and we have co-convened the ACTA access to diagnostic pillars with Global Fund during the pandemic. So I will take you back to the pre-pandemic period, which might seem like a long time ago, but it's just 3 years ago. Very few diagnostic tools were available to areas where actually people live, work, or go to school, especially in low and middle income countries. Access was actually difficult, and those tools that were really limited were only found at hospitals. Fast forward, during the pandemic, technology innovations in the first 24 months of the pandemic, like with vaccines and therapeutics, was unprecedented. So more accurate and more affordable tests moved closer to the primary care and community settings. But we have to watch the trend. COVID-19 really accelerated the development, but this development was then followed by an overwhelming number of tests in the market. And however, there was no centralized resource that would be able to track all the information for more than 2,000 products regarding their availability, their regulatory status, their performance, their impacts on, from the various variants that spread during the pandemic, and various other characteristics. So during the pandemic, there was a unique moment on testing, right? There was a lot of talk, many key figures in, political arena or multilateral organizations. They really backed up testing, and they highlighted the importance of testing in order to fight and have a good response against the COVID-19. So everybody started sharing information in their own dashboards. FIND has also created a dashboard about testing coverage in COVID-19, and we really wanted to highlight the unequitable access in testing for low and middle income countries. Many countries had their own dedicated dashboards where they could have information on cases, on deaths, on hospitalizations. Not many had on tests, but we managed to find information on tests there. And it was for the first time that a disease would have such a dedicated response, and we could have access to data on testing. However, this exposed also sort of wild west of information because as new tests were flooding the market, people were actually trying to find and make sense of inconsistent and unreliable information on key questions that needed a decision right away. So questions like which assay is actually best to detect the infection, which testing strategies are best for each country, how can a country build testing capacity in a short period of time, what about global competition of diagnostic kits, and which tests have regulatory authorization for my country. All these questions needed urgently decision making. So this is when FIND started putting together, even before the pandemic, but the pandemic made the need for that platform really urgent. We put together a facilitation platform hosted by FIND in order to overcome these diagnostic gaps, connecting stakeholders and enabling interactions. So through the DxConnect diagnostic marketplace, which is a secure and digital platform, there is a support service in order to connect buyers and sellers and facilitate the procurement of affordable and quality assured diagnostics. Then we put together information in order to democratize the access on various characteristics of tests initially for COVID. We collated information, we gathered information, and we accepted submissions by manufacturers in order to bring this sought transparency to the diagnostic landscape. And we enabled interactions between manufacturers and sample custodians that needed, samples were needed in order for the manufacturers to gain access to samples for their feasibility studies and in order to build evidence about whether their tools were working or needed for regulatory authorization. And this was done through the DxConnect virtual biobank. Today, I'm going to talk only about the DxConnect test directory section of DxConnect, and I will tell you how the DxConnect directories were born. First, we put together the COVID-19 test directory. It's our shiny application. I'm sure if they're epidemiologists or people that are data scientists, they know R. We had a lot of expertise in the team, in the data science team. And since COVID accelerated the development, COVID also accelerated in our team the production of data communication products. R was the tool of choice, and it actually helped us to put together a platform that was easy to, as an interface for the users, but also easy and flexible for us to change features according to the feedback from the users. So learnings and feedback from the COVID-19 test directory guided the development of other subsequent test directories that were needed when, for example, the monkeypox outbreak happened, and we launched the monkeypox test directory in July 2022. Then we also launched the Ebola virus test directory in October 22, followed from the Ebola outbreak. We believe that test directories really enable users to browse through the data and filter all the various characteristics, such as primary use case, disease target, stage of development, and regulatory status. And I will show you more because I will go ahead with a demo. But it was clear that up-to-date and accessible information is of utmost importance for controlling infectious diseases and enabling access to healthcare for all the vulnerable populations in low and middle-income countries. It was also clear to us that there was a pressing need for such a resource for NTDs. This is when we also launched the NTDs test directory, because we really believe that their NTDs are already burdened by limited investments, and there is a very slow and fragmented R&D, leading to sometimes duplication of efforts. The NTD test directory is an open access platform. Again, it is a shiny application with visibility and transparency in order to streamline all the NTD's programmatic actions. We believe that it presents a comprehensive NTD diagnostic landscape in order to reduce the duplicated efforts, and it's populated via submissions either from test developers or by submissions that are handled through text scouting from the FIND business intelligence team. I will also click now. I hope it pops up in another tab. Okay, as soon as I click, I hope you can see my screen. Yes, you can. This is the Find website, and there are two ways to access the DxConnect test directories, either through the data and impact or through the tools and resources. I will choose the data and impact this time, where we host different reports, financial statements, impact stories, and we will go at the dashboard side. So here we host all the different dashboards that the data science team has built with collaboration of other teams in Find. First, we have the DxConnect test directories. We have the COVID-19 test tracker, which I referred to earlier, where we tracked during the pandemic all the different test coverage across countries. We have the COVID-19 test policy map, which again shows throughout the pandemic how the testing policies changed. And we have the next generation sequencing capacity map, which is empowered by a collaboration with Rockefeller, where we gather data from GISAID and our own COVID-19 tracker in order to build maps of genomic surveillance. I will go back to the DxConnect test directories. Here you will find all the DX directories that I talked about. First, the COVID one, and then I can show you the neglected tropical diseases one. So the application is quite lightweight, and it can be accessed by areas with low bandwidth. People can see directly the very easy to go through interface. There is a filtering section that is interactive across with the graphs. So most of the diseases that are currently that have some tests in this application, they're for Chagas. Okay, most of the tests are for Chagas because this is the one disease that the business intelligence team did their technology scouting for. All the other tests for other diseases were actually submitted by manufacturer. So in total, we have 106 tests populating the test directory. I will show you, for example, a use case now. I will select all the different diseases, and then I will remove Chagas just for the sake to just give a chance for the other diseases to show up. You can see that we remain with 25 tests. We can interact. There is a hover option on top of the graphs where you can see how many tests are available. The user can already see some insights using the graphs. Most of the tests, they have as their primary use case to be diagnostic or confirmatory tests. There are very few tests that are under validation. Most of them are used just for research use. Others are at very early stage of development, and only 3 of them are actually regulatory achieved. Then again, what I told you, the difference with COVID, most of them are still lab-based. Not many of them are near point of care or true point of care. And we have immunoassays or molecular assays. And of course, we have the region or company headquarters. Only 4 of them are based in Africa. Most of them are based in Asia and North America or Europe. So all of these graphs are actually downloadable, so the users can use the graphs as they come. If you can use more filters, again, the graphs will change, and you can use the graph as per your needs. But if you don't like the the graphical interface, we can go to the list of tests where there is a tabular format. I will reset the filters here. So there is a function where we can search across the different columns in the tabular format. For example, I will search for cysto, and I will have only 4 tests coming up because these are the tests that are under cysto. And the user can also download the data either in CSV format or in Excel format. And yeah, they can do further analysis for this kind of data or produce their own sort of report. I can download the data here. So this is the so far the user interface. Manufacturers can submit their tests here, requesting to add a new test. So there is a user interface, sorry, there is an other portal or website that will come up with a form. Initially, people need to enter their website or the domain from their company website and their email. If they have submitted tests before, they will need to log in, and most of their submissions will be found in the portal. which is a good way to keep up with all the different submissions. So our vision in FIND is that we really want to democratize access of information around diagnostics. And we really want to centralize all this information. So in order to make this happen, we believe that is essential, and we're currently working on putting together a diagnostics and the DxConnect data portal for diagnostics. Users can actually browse on different information that covers topics such as testing coverage, investment, financing, diagnostic systems optimization, impact and progress towards global goals, and more. In order to do that, at the moment, we are currently undergoing a sort of period where we are trying to put together the UX and UI interface journey for the users, respecting that there are multiple sort of thematic areas that the user could want and access information from. And we would like to also collaborate with a global health community in order to gain more data, so more people could sort of contribute data sets to this portal. And in this way, we could also collaborate with them in order to help, increasing data literacy in the field. Users will be able to browse and download just data sets or geomaps, locations of different data sets. But there will also be dedicated sections with stories that need to be highlighted, where people could have dedicated sections for data browsing and also visualizations. So thank you very much for the opportunity given me today to present to you. Together, we can ensure that everyone who needs a test can get one. Thank you.
Wow, that was absolutely amazing. And honestly, that last slide, or that whole movement towards a single portal, the data, this is one of the questions that I've kind of formulating from looking at Austin's work, looking at that the inevitable convergence of all things data, and what would those collaborations look like? I'm going to come to the Q&A at the end. I think that was absolutely brilliant. Thank you very, very much for that. And we can see the evolution in the tool as it's going, and I think that's something we're going to pick up on the Q&A. I think that's fantastic. A lot of food for thought. You mentioned R and Shiny. We've worked with, we've had sessions with Dr. Paula Moraga at KAUST. Honored to have her talk about our Shiny adventures beyond all of this. Development of various kind of approaches with those languages. So absolutely fantastic. And I love that last slide. I think that's going to have a lot of questions going to pop up around that. So thank you very, very much for that. That brings us to our next speaker. You may have seen Mrs. Jessica Ahedor-Kyei come in and out of the platform there. Jessica, I don't know if you're still there or not. If you're not, please feel free to log in. We really want you here because if you're the CEO of the Science Journalism Ghana setup. We want to have that perspective as well into all of this. I think it was illustrated very beautifully by the last speaker on the last slide, in terms of that map with the civic society on there, public on there, everything's on there. We see a huge role for science journalism in this, in marrying all parts of the map. And so this is one of the reasons we wanted you on board. If you're not there...
Hello, I'm not sure if you can hear me.
Perfect. Jessica, perfect. We can hear you. We can hear you.
Okay.
You just
Thank you so much for the opportunity.
You just have to put your camera on the top.
A bit of challenge.
Yeah.
I've been having challenge with my connections. I was trying to log on to my laptop and it wasn't working. Pardon me for that.
No. We can hear you very, very well. if you want to put your camera on, if you've got enough bandwidth or whatever, if it's easier for you, on the top, there's a bar and you've got various icons, and the camera icon.
Okay.
Yeah, there we go. Perfect. There we go. Excellent.
Okay. All right. So I'm Jessica Ahedor, as you rightly introduced me. And I birthed the idea of science journalism Ghana. I realized, or studying the media landscape here in Ghana, I realized that most of my colleagues are always doing the same thing, that is reporting on mainstream journalism, that is politics, business, entertainment, and others. And the science bit of it is lacking. So most newsrooms, as we speak, still don't have science or health desk. So I remember back in 2015 when I was in the newsroom, mainstream media, how we keep pushing for health desk to be part of the main editorial teams in the newsrooms. So we succeeded in a way. Now, at the advent of COVID-19 also brought in a twist, and we're seeing most of newsrooms reporting on health, but not in real-time sciences. So I realize most of solutions that we need to our challenges, as well as in the global south, hinges on these scientific knowledges. And as a result, our scientists are also doing a lot, but we don't have the capacity to churn out those informations that they put out there. They are either stuck in repositories, and few elite people have access to those knowledges. So I was thinking, and with a few consultations and a few trainings outside the country, I got the opportunity to delve into that area. So this is what led to the Science Journalism Ghana platform. And our main aim is to give voice onto what we are doing, and also partner with companies that are in Europe and other Western world, so we could build that resilience that our health systems need in the global south. That notwithstanding, I know our scientists over here are also doing great jobs, but those jobs are not given much of attention. Let me say, they are not pushing to the forefront of policy making. So we thought it wise to be pushing some of the informations or the results of their researches into the policymakers, so that we could shape policy around what might actually benefit the development of our countries in the global south. Having said that, one bit that I was asked to speak about has to do with in relation to our topic for discussion, that is NTDs. So I happen to be on the field, and I am still going as and when we see, we hear something that is of interest to us. So we know how NTDs has wreaked havoc on the Western, that is the global south, us in Ghana, and our sister or neighboring countries in West Africa. Talk about Nigeria, talk about Niger, Senegal, and other parts of the countries that are located in the western parts of the region. So when we decided to do this, we knew the kind of challenges that are there, that has to do with, one, access to the needed resources that we need as media to be able to venture into this field. We also realized that we had a low technical know-how, because not many media houses are really vested in reporting these kind of technicalities when it comes to science. So we seek for the assistance of the few organizations that are around, and most of them could be donor organizations that are outside the country. They come in and help us so that we will visit the fields and report what is really happening in real times on the field. So with the help of the National NTD Control Program under the Ghana Health Service, we for the past 4 years they've been doing the countrywide drug administration program. You will see us following them because we really want to find out what is going on in terms of schisto, in terms of hydrocele, in terms of trachoma, and other conditions that are endemic here in our parts of the world. So we've succeeded in doing that. And as you may be aware, Ghana eradicated trachoma in 2018. That was the first country to do that in the sub-region. And we will say that with the help of WHO guidelines and the implementation of the strategic interventions that have been put in place by the National Control Program, we, the reporters on those beats, are also following up on daily basis to make sure that we speak to the issues that are on the ground. So that's how we fall through it. And when we did the documentary on the trachoma condition, at the time we were doing it, that was 3 years ago, Ghana had already eradicated the condition, so it wasn't endemic in Ghana anymore. So we had to go to Nigeria. My colleague Abdul, who is now at MIT, pursuing other further studies, we had to do that. Most of these things that we do has to be out of our own pocket. We fund these trips. And we wish if we have the support that we needed as journalists who are in this bit, it will be of a great help unto us. So most of the challenges I couldn't speak to, that is, we don't really need the monetary kind of assistance. We could have an assistance in kind, where organizations could come in and wanted to support this group of journalists who are in these beats reporting this kind of information, so that we push the information out there and make sure that we get answers to real-time challenges that is confronting people on the ground. So basically, I would say this is what I can say about reporting on NTDs. We also realize that funding for such programs in terms of surgical operations, governments don't really have budget for those things. So it always has to be donor organizations that will come in and allocate some funds so that we could do a nationwide kind of surgery for people who are suffering from NTD conditions. And these are one of things you will see them, most of them coming in or helping out probably once in a year, when we are about celebrating or commemorating this kind of days that has been listed on the WHO calendar. So in real time, we have been questioning governments in the region why they don't provide resources for these conditions that are bedeviling people on the continent. So basically, that's what I can say. I'm unable to have a slide prepared because I tried to reach across and I couldn't get any feedback on what we were going to talk about. So I was guided on what tips I can give on what we want to discuss today on our part as a journalist who are on the field. I hope I made sense though.
Thank you very, very much indeed, Jessica, for that. You made perfect sense. And I think it was very important to have your perspective on there, because in essence, we're talking about cohesion between communities, The WHO itself is talking about, well, in their NTD roadmap, they want one of the changes in that roadmap, that guideline report, is really to have more of a country ownership of these diseases, right? And I think to achieve that, we need everybody on board. And so absolutely relevant, and we're delighted you can actually join us for that. So I think we will pick some of that up in terms of the Q&A. So thank you very, very much for that. It was much appreciated. We've had some, so other people who joined us, Dr. Gasu Kolebali from the Côte d'Ivoire, Dr. Alemeu Kasahun from the Collaborative Research and Training Center in the Neglected Tropical Disease Center in Arba Minch in Ethiopia. And Dr. Kasahun will be actually going over some film work they've done, a very beautiful film on terms of scabies and reaching into the communities there. That will be for tomorrow. So I would urge the other audience members to kind of get stuck in. It's the last session. Put your names and put your countries on and say hi, because this is an immersive session. We want you to be part of the questions and to ask and to get involved. I think collaborations have been mentioned just there by Jessica, the desire for partnership even, certainly from Anna's the FIND diagnostics, the FIND presentation, that last slide really spoke volumes to the potential for massive collaboration to come through. And I would love to see how we're going to marry consumer, almost self-diagnosis in a way, with the, or to a point, with the no dengue approach by Takeda, to what happens next. You know, who else do you need to partner with? We can bring all of that in. I think that's very interesting. We've had Sunny Mante join us from Ghana. We've had Dr. Edubil Alpizar join us as well, and he's also asking a question, so thank you very much for that. And also, please do put other questions in as well, and we'll come to the Q&A at the end. That kind of brings us to the last speaker for this particular session. We've got a really honored to be joined by the National Dengue Control Unit in terms of the Ministry of Health from Sri Lanka. Dr. Lahiru Kodituwakku, the Disaster Management Focal Point Medical Officer. And also, I think later in the Q&A, we'll be joined by Dr. Jagath Amarasekera, the Consultant Community Physician Specialist in Public Health at the National Dengue Control Unit, Ministry of Health, Sri Lanka. I just need to get the job titles right, so I was reading those job titles off from there. We're honoured that you made time for us and you're joining us today. Your handbook that you've co-produced with Australia Aid and other partners in that has been placed onto our showcase. Someone had asked earlier, Dr. Ivana Blatter had asked about the overlaps in terms of climate type of news, information, situation, and that's something that your multi-hazard approach is really going to look at. And I think it's absolutely topical. One of your neighbor countries, Pakistan, 33 million people have been displaced, because of the flooding. And dengue is on the increase there because there's hardly any infrastructure left in the southern areas. And those adverse effects are going to increase. It's not going to be a stable situation. They're going to get more and more intense. So we'd love to hear your take on everything. Thank you very much for joining us. I'm going to be quiet now and back out and hand the floor over to you, sir. So over to you.
Thank you, Kamal. Thank you for ISNTD for giving us this opportunity, especially for Ministry of Health Sri Lanka. Let me share my presentation. So today I'm going to present about our latest knowledge product. As Kamal said, our latest handbook on scenario-based training on multi-hazard situations and complex emergencies for grassroots level public health workers and first responders. Throughout this presentation, I'll be talking to you about the public health impact of dengue, sort of the Sri Lankan context, Sri Lankan situation, and why we have been thinking about addressing this dual threat or confronting the dual threat, dengue amidst multi-hazard scenarios and different disaster contexts. Then rethinking about the way we prepare and respond to different hazards, including that of biological hazards like dengue. And what is beyond this step? What is beyond this handbook? Way forward in training on dengue outbreak preparedness and response amidst complex emergencies. So I'll be highlighting these key points during my presentation. I'll be joined by Dr. Jagath Amarasekera, Consultant Community Physician at the National Dengue Control Unit during the Q&A session. So to give you a brief about the current dengue situation as well as the trends of dengue in Sri Lanka from 2001 to 2023. Now, dengue was first serologically diagnosed in Sri Lanka in early 1960s. Since then, we have been observing sporadic outbreaks. But during last 2 decades, we have been observing that the intensity and the magnitude of these outbreaks have increased and the endemicity levels has increased. Now, you can clearly see from this graph from 2001 to 2023, this year, the endemicity level has gradually increased. But when you consider the endemicity level with the case fatality rate, in the line graph, you can see the case fatality rate. Case fatality rate has gradually declined. So you have, in one part, you have high incidence of dengue in the country, high endemicity level, but we have successfully able to reduce the case fatality rate during last several decades. Now, the reason for this decrease is partly due to the capacity building and training we have been doing for first responders as well as primary healthcare workers and first contact physicians in the country. And there are other multitude of causes as well. But in this specific presentation and in this specific knowledge product, we have been sort of targeting the capacity building aspects and the communication aspects in dengue, which has helped us to bring down this case fatality rate despite high endemicity levels of dengue in Sri Lanka. Now, this is the seasonal variation of dengue in Sri Lanka. Now, in Sri Lanka, we have 2 monsoonal seasons. One is southwestern monsoon, which happens during May to September in each year, and northeastern monsoon that happens during December to February in each year. So we are expecting peaks of dengue, the cases to be rise during these monsoons, subsequent to these monsoons. So every time we are having these 2 peaks at different geographical locations of the country. For example, in southwestern monsoon, we are expecting a high number of cases from the wet zone of the country, especially in Western province, which bears the large majority of dengue cases in the country, around 50% of the dengue cases. And in the northeastern monsoon, we are expecting cases in northern and eastern part of the country, that is the dry zone of the country. So as you can see, there are 2 peaks, and as I said earlier, we have a high endemicity level of dengue along with these 2 peaks. So a substantial burden, a considerable burden is exerted upon the health system every year due to dengue. If you see the age distribution of dengue, we can have a clear idea why this has been a burden for the country as well as the health system of Sri Lanka. So if we analyze the number of cases in 2023, we had around 76,689 dengue cases throughout the island, of which 62.4% are from the productive age group, age cohort. That means from the age of 20 to 59 years of age, the people who are contributing to the economy of the country, as well as for the economic activities of the country. The most worrying fact is that around 25% of the dengue patients in Sri Lanka belongs to school-going age as well. the age cohort between 5 years to 19 years. So the school-going age children comprise of 25% of total dengue cases in Sri Lanka. So you can see the people who have been exposed to outer environment, they have been exposed to dengue. And these age cohorts that are vital for the country's future as well as vital for the country's economy bears the brunt of dengue epidemic. And this is why the dengue has become a great burden to the country as well as to the health system of Sri Lanka. Now, Sri Lanka have been experiencing different kind of disasters, including dengue outbreaks in last few decades. But since lately, we have been observing some differences in trends of these disasters as well as outbreaks of dengue. For example, now Sri Lanka has been ranked at the number 31 in climate risk index, which ranks the countries according to the natural hazards that have been affected these countries and the losses that have been incurred. So Sri Lanka is in a very high position of rank 31. But since lately, we have been observing that these disasters, the disaster ecosystem has basically changed. Now we have been observing multi-hazard scenarios where one disaster, one hazard on top of another hazard. For example, we had dengue and we had COVID-19 together. We had dengue with flash floods, urban floods, and we had dengue with a prolonged drought several years back. So we have been observing a different context of hazards. And we have been experiencing cascading effects of these hazards as well. For example, now we are undergoing the worst economic crisis we have observed since independence. So this economic crisis has led to food insecurity. On top of that, we have sporadic dengue outbreaks in several parts of the country. So there are cascading effects throughout the recent times. And systemic nature of these hazards has changed. Now, earlier we used to respond to health hazards that are confined to health system only, but now we are witnessing hazards or disasters or crises that transcend different sectors. For example, COVID-19 and dengue can impact on the school-going age children and may disrupt the continuity of schools as well. So there are systemic nature of these hazards have impacted several systems, unlike in previous years. That is why National Dengue Control Unit, which is the focal point agency for dengue prevention and control within the Ministry of Health Sri Lanka, has thought to sort of rethink the way we prepare and respond to these dengue outbreaks, as well as dengue outbreaks amidst different complex emergency scenarios. So as a starting step, what we did was we did a training needs assessment of grassroots level public health teams. As you all know, Sri Lanka has a very diverse and very robust primary health care system, public health care system at the grassroots level, which is headed by the medical officer of health, a medical doctor with his public health team of public health inspectors and public health midwives who sort of deliver health services to the doorstep of the customer. So we did a training needs assessment of grassroots level public health teams, and we made a training blueprint based on the evidence generated through this needs assessment. Now, when we do these, when we have done this needs assessment, we came to know that the traditional way of training, for example, doing lectures and doing presentations, now the new generation of these public health workers, or younger age cohort of these public health workers, as well as first responders, they thought of we need to shift from these traditional methods of teaching to a newer methods or novel technologies. So we select a scenario-based training methodology through expert consultation. We had several consultative workshops to identify core thematic areas for scenario development. We had experts from meteorology department. We had experts from Disaster Management Center, National Building and Research Organization, Family Health Bureau of Ministry of Health, Nutrition Unit, so that each and every aspect of these crises and disasters which come together with dengue outbreaks are addressed along the line in this scenario building. So we developed several scenarios that includes dengue as well as other hazards at a given point. We explore the local context first, because we have to tailor-make these different scenarios into local context so that we can do this training at different levels in the country, different provinces in the country. And we align the principles of dengue outbreak preparedness and multi-hazard and crisis management with these different scenarios. Then what we have done is we create propositions, we create assumptions, so that during the training we can give some of these injections to the trainees so that they can rethink about how they respond and how they prepare for these multi-hazard scenarios and complex emergencies. And we included dengue and other compounding hazards, both natural hazards as well as man-made hazards that we have been experiencing throughout our history. We pilot tested these specific scenarios in a dengue high-risk area as well as a disaster-prone area in Sri Lanka, and got those inputs from the grassroots level health workers about the context of these scenarios, the timing, as well as the ability to understand and comprehend these scenarios as well. So we basically, after finalizing the scenarios, we did trainings in 5 disaster vulnerable and dengue high-risk districts. More than 400 medical officers of health, public health inspectors, and public health midwives and other first responders at the ground were trained through introducing different scenarios in a multi-hazard and complex emergency setting. And feedback was recorded at the multiple levels. Both public health teams, health and public administrators, local government people, then non-governmental organizations, community-based organizations, armed forces who are involved in first responders in different kind of disaster context, including that of dengue. So a paradigm shift in preparedness and response strategies were envisioned, and preparedness and response to be made more proactive rather than the reactive approach that we have been engaging throughout the years. A cohesive and coordinated effort, a cohesive and coordinated approach against the compartmentalized approach that we have been engaging in dengue outbreak preparedness amidst other complex emergencies, maximizing the use of scarce resources without overburdening the public health workforce, and also intra and intersectoral involvement. For that, we have engaged with, as I said earlier, different sectors who are involved in responding to different kinds of hazard, including that of dengue. So finally, as a result of this training, which engaged many first responders and public health workers at the grassroots level, we were able to make a handbook. By analyzing the feedback from these training workshops, we modified several scenarios to meet the training outcomes. We validate the final set of scenarios and injections with the expert panel. And finally, we develop a user guide and the role of facilitators and role of trainers, and develop this handbook, which is aptly named as scenario-based training on multi-hazard situations and complex emergencies for grassroots level public health workers and first responders. So this is the first kind of This is the first book, the first handbook for public health first responders in Sri Lanka on multi-hazard scenarios and complex emergencies, including that of dengue. So you can see how we have developed these scenarios and injections, taking example from different regions of Sri Lanka and different hazard context. And in each and every hazard context, we have included dengue as a co-hazard as well, so that we can include the principles of our dengue outbreak management and dengue prevention during their training. So to make this book, we had the support of Disaster Preparedness and Response Division, which is the focal point for disaster response within the Ministry of Health, and World Food Programme supported the training sessions as well as printing of the handbook as a part of their monsoon preparedness plan. They have been engaging with us since then, and we have planned several other knowledge products as well. and handbook was finally disseminated to practitioners across the globe through the UNDRR prevention platform. So what were the benefits and opportunities that we got, as well as the primary healthcare workers got through this handbook? Now they learn to appreciate the emergence of dengue amidst other disasters and crisis situations. Earlier, they were responding to different disaster situations in a very compartmentalized manner, but since the training, since the launching of this handbook, they learned to appreciate the emergence of dengue amidst other disasters and crisis situations, and they enhance their risk knowledge about the multi-hazard and complex emergencies. And we also use this handbook as a training of trainers guide, so that the trained grassroots level health workers can go to their institutions and deliver this training to their colleagues and other first responders within the field. And we also hope to further escalate this training, build the capacities on simulations, by doing simulations on dengue and other different hazards together. So we will be planning the first such simulations most probably in next July. So beyond the scenarios, beyond making this handbook, we have been able to develop a paradigm shift from traditional didactic training methodologies to more action-oriented scenarios and problem-based training. And we have been able to mainstream dengue prevention among other disaster preparedness and response agencies within Sri Lanka and other countries, and governments and non-government partners. So that was the main plus point as a focal point agency in dengue prevention and control for us. And we have been able to strengthen the core of public health system in Sri Lanka, the grassroots level health workers and first responders. So this is the story of this handbook. I think you all can download this in this platform as well as other global platforms. We have basically disseminated it globally. I would like to acknowledge the World Food Programme Sri Lanka for supporting us, as well as Disaster Preparedness and Response Division, University of Huddersfield, United Kingdom, and provincial and regional directors of health services and other all sister agencies that have been working with us in dengue outbreak control, as well as dengue prevention and managing other hazards. So thank you very much.
Thank you very, very much for that. Absolutely amazing effort, and really interesting how you're talking about the paradigm shift to a more proactive sense of outbreak management and preparedness. And so I think that's going to play quite nicely in terms of the Q&A that we have. So thank you very much for that. And I know for the Q&A, we've been also joined by the National Dengue Control Unit. We're being joined by Dr. Jagath Amarasekera. So please feel free to, I think you have your own link as well, so you can click onto that. And I would say to the lovely audience, before we start the Q&A, we've put the access to the handbook over there. It's on our showcase as well. Please do send your questions. We've got a few questions in there, and I'll come to those in a minute. But please do feel free to put some questions in there as well. And if I could just ask all of the speakers to come back, we can have a quick session. I think Lahiru, you might have to put this you stop screening, stop sharing your screen. Yeah, perfect. There we go. Brilliant. Excellent. I believe that's Dr. Amarasekera in the background as well. Hi there. Yeah, hope you're doing well. Brilliant. And thank you very much for joining us. There's a fantastic handbook. We love that because it's kind of real, right? It's a real life situation here in terms of having to really grasp that. And so that does that in a very interesting way. And this training issue around it is very interesting. So I want to, there's a kind of blatant feeling in the back of my mind. So I'm just going to say this, yeah. So because of that slide, Anna, that you showed, it's because of that slide, actually, it just feels like there should be a mega kind of collaboration. I'm sure you agree at some level between everything you're doing, whether it's Austin with the no dengue approach. I'm absolutely serious, because you're talking about self-diagnosis to a point with the consumer. After that, there's a trigger, right? What are they going to do? Go to a doctor? Now, then what happens, right? There's a natural line to this end slide, and I just thought of it when I saw it. I haven't seen those slides before, but I think it's got a lot of truth to it. So I want to say that. And by the same token, your multi-hazard approach. I know you mentioned some of the stakeholders, the UN agency, the World Food Programme. I think Australia Aid are in there somewhere as well, I think. That in its own right speaks to many different sectors. And when you look at the WHO background, they want to get rid of the rhetoric around multidisciplinary, multi-sector. They want it in a real way. It's one of the shifts in their NTD roadmap. They want to see intersectorial collaboration. So I'm going to ask this question. It's a very blunt question. I'm sure, I don't know if you're allowed to speak about a feeling. Yeah. Should there be a product between you? I say product, but should there be this portal? Should there be this collaboration? How do you envisage that? I'm going to ask Austin first.
Thanks, Cameron. You raise a fantastic point, and I do believe that there is an opportunity to be able to collaborate, partner in the fight, in particular against dengue. As a company, Takeda think of dengue as an integrated prevention program where there are many tools that are required in order to be able to prevent dengue. And I think the way that you described it, and in particular from a marketing sense, that journey that you described is a very appropriate way of bringing that integrated approach together. So yes, I would certainly advocate for that as well.
Brilliant answer. I'm going to ask the Sri Lankan contingent, and then I'm going to come to you, Anna, because you've got the slides. So that's why. Yeah.
Thank you. Thank you for the great idea. I think now, if you see all three presentations today, now from Takeda, they have developed a fabulous app that can communicate to grassroots level communities living with dengue, and we have a very comprehensive dashboard displaying all the diagnostics. And the most important thing, as you suggested, that we have to make a link between all three. Now, we have been engaging the grassroots level health workers. Takeda have been engaging with the communities, and the diagnostics have been sort of engaging with medical doctors and the laboratory technicians. So for a comprehensive model that can sort of address dengue prevention and control in this century, needs to sort of incorporate all three aspects, so that the most vulnerable people or the most vulnerable population cohorts can get the benefit of all these interventions. Dr. Jagath?
Yeah, I think I also agree, because as we know that we can't go alone on this, so we have to get the involvement of all the sectors. So as Lahiru also mentioned, we have also taken into consideration the intersectoral various sectors to play in a role in this dengue control and prevention. So the way forward is, as Lahiru also mentioned, is to go beyond that and take the other aspects and international level also to discuss and go forward.
That's a fantastic answer from both of you, from both Austin and from both of you. So the pressure's on, Anna.
No pressure. Actually, I'm really glad. I'm really glad that this question and this conversation goes there. We actually put the patient journey across the care cascades, in the forefront. Diagnostics is not the beginning of the journey. Diagnostics actually takes the patient from the beginning until you find, your answer, and then you can follow up on your treatment, what is the severity, and then whether you're actually cured. So having that in mind, we also want to have it as a feedback loop across with the life cycle of diagnostics, but we can also intertwine it with all the different, products that are in the health sector, vaccines, therapeutics, and all that. The need for a data portal for diagnostics is, unique for FIND, but a data portal for global health where people can access information, comprehensive information, is of utmost need, I would say. And especially because there are not many resources. Usually we reinvent the wheel and we compete for resources and funding between us. So if we can create a consortium of, people that could sort of support and have this same vision, it would be great.
Yeah. That would be the holy grail of today. Our whole thing here is we really want to see partnerships and collaborations. We have a motto from day one. We're 10 years old, progress through partnership, right? So we would love to see that happen. You mentioned R and Shiny. I kind of touched on this earlier, but people like Professor Paula Moraga, she's at KAUST, as you well know, wrote the handbook for programming in R and all of the various climate variables that you can bring in, discrete variables, and suddenly you've got some relationships there in terms of between data sets. When it comes to climate, and I think Dr. Ivana Balata had asked earlier about overlapping scenarios. So, Zika, let's say, are different disease sets, but arboviral disease sets, right? Chikungunya, we had it earlier, for Valneva, with their approach to it. So overlapping disease settings, but then very, very interestingly, overlapping situations like this in terms of the climate events that are impacting this space. All of this is adding to the disease burden. It's totally changing the way communities have to be engaged with. So I think, honestly, we had a session with her about a year ago to bring some of that in. And so I wanted to turn that actually into a question, because, okay, so we've talked about the community and we talked about the kind of I'd say natural endpoint in terms of a journey of all your things, the convergent endpoint happening, and based on this data portal endpoint. What about the how to put this? You've got all of the young people in these communities. You've got all these people in these communities. Can they not be harnessed in terms of coding, in terms of geomaps, in terms of actually getting them up and speaking about a kind of digital world for them that they can inhabit? Because you're talking about trust here being placed into the community, but they're then becoming part of the solution, right? It may sound wishful, but this is a kind of distillation of everything we've heard today. From 9 a.m. we've been doing this till now. World Mosquito Program used a term called borrowing trust from a community of practice, right? So that's what they say. How do you, how to put this, hardwire that into the community itself? What skills are needed and whose role is it to get those skills out? We're talking about mentoring, the state, the private sector, the PDP, who? I'll ask Austin first, your views on that. Your views on that. How do we generate this community, keeping them not just using your platform, but generating parts of it, new packages for it, new kind of directions for it?
Yeah, that's a great question. So as an initial step to that, we've obviously developed our social channels, Facebook and Instagram, that enables the sharing of information and education in peer groups of those individuals that are visiting our websites. In extension to that, I think there are opportunities. You talk very eloquently about citizen science projects. I think there is a great opportunity for us to be thinking about how can we harness those citizen science endeavors to be able to bring them and share them more widely as well. So I think in extension to specific skills and competencies like coding or programming, there are opportunities there yet. From a pharmaceutical company perspective or vaccines company perspective, there always is the legal and regulatory and compliance aspects that we need to think about, which sometimes makes that collaboration a little more challenging. But I think if we are the power through partnerships, as you were saying, I think that's a great way to look forward.
That's brilliant answer, very honest answer, very encouraging answer. Thank you for that. Also, from the Sri Lankan Ministry of Health perspective, in terms of, the kind of youth that are going through various education programs, the various sectors, you're talking about multi-hazard scenarios, so different agencies. What are the skill sets needed to fully engage the community and to drive sustainability in this type of project leading to this data portal? What do you think?
Now, to transfer the knowledge or transfer technology, novel technologies to communities, there has to be a vehicle that we can transfer, because we can't sort of go into the community and straight away put all the ideas that we developers and we professionals have in our minds to the community. So the first step would be the identifying the local context first. What are the preferences and choices of the local population, especially of younger population? So in Ministry of Health, Sri Lanka, we use two different methodologies. First one would be identifying these community champions or community leaders within the communities. For example, now through this handbook, we have identified public health midwives as sub-community champions. Although they are not directly involved in dengue prevention and control activities, but they have been trusted by many generations of communities for delivering maternal and child health services. So why not use them for delivering the message of dengue prevention to the communities? Why not we use them to deliver the message to the younger people? So that is one aspect. The second aspect would be to launch different kinds of novel technologies to, as the speaker from Takeda very correctly said, through social media and through novel platforms. So we have identified school teachers and principals as one of these change agents, where we have developed another app, Dengue Free Child app, where a trained school teacher or a trained principal can sort of use this platform as a fever surveillance platform, so that the health workers are informed about the cluster of dengue cases within the schools. So these kind of approaches, I think, can narrow the gap between the developers and professionals and the community cohorts within the community. Dr. Chow?
Yeah, I think Lahiru mentioned most of it, and yeah, thank you. I think that's a great question. In addition, maybe I would like to add that even for developing the training, also we use the community-based organizations also are involved actively in this. So that also plays a crucial role, because they go to the community and they are always working with the community. So when they give their inputs, that also gives a good feedback.
Well, that's a fantastic answer. This is the actual reason that we'd asked the Science Journalism Ghana organization to come as well, because we felt there is definitely a role, right? You're talking about cohesion and bringing things to life. There's definitely a role there. And so, but I think they're having a brief connection issues. So I'm very sad to say that I think Jessica's dropped out because of a connection issue, but we can pick that up later. I think that's brilliant. Just coming to this novel. Jessica, you're there.
Yes.
Oh God, I didn't realize. I'm so sorry. You turned into a big, our logo basically. I was thinking, where's the Jessica? Okay, so, well, great. That's brilliant. So you've heard that everyone's working towards this common, let's say, data portal, or, an iteration of that, or some kind of common platform where all of this data is stored and used and for the good. Your role, or a role as a science journalist, how do you see that interfacing on digital, impacting that, bringing these together?
Yeah, so I would say gone are the days when we will have to be chasing organizations for information to be able to do our stories or bring the reality onto the stories that we are telling. But now, this is the way the opportunity has been presented onto us. It's a good move, and I'm lauding it because I know what journalists go through on daily basis just to have access to information,
Yeah.
to make sure that you have a balanced story out there, because you can't be writing a story that involves about 3 or 4 people and then you use only one source to write a story. We are in an era where
Yeah.
we are talking infographics. We are talking
Yeah.
bringing that reality onto the story that you are telling. So this is just a way. It has made it very easy for us so that we'll access those informations. It also helps us to also do a little bit of comparison. That is comparing systems that are working elsewhere and just opposing the good practices into the countries that are also struggling. So it's a good move, and access to all these platforms will help us so we can also tell our stories in a balanced way.
That's a brilliant answer, because people overlook the role of journalism, I think, massively in this space. And dengue, if we're sticking with dengue, look at the effect of misinformation, right? In
Yeah,
this
so
particular,
yeah,
was a
sure.
huge
What
issue, right? So
it's
yeah,
there's a whole lot of misinformation, and there's myth and misconceptions.
yeah,
There's a whole lot going on when it comes to the space of reporting on the sciences, not just on the health sciences and talk of the NTDs.
yeah,
Could you imagine still to the 21st century, some 21st century Ghanaians think that some of the conditions that they that affect people as a result of bad omen, and they
yeah,
allude the causes to
yeah.
a whole lot of things that you sit down and reflect on these things and you ask yourself so many questions that you don't have answers for. And it is our duty to make sure that we educate these people so that they get informed. And once they get informed, we can prevent like 50% of the conditions that need to be prevented. And until we do that, we will still be meeting and be talking about how to prevent it, because they need to get informed first. And it's
Yeah,
only the journalists that will do the bridging. There's a
yeah,
gap between what the pharmaceutical industry is producing something, the consumer is lying somewhere, there's some information being produced out of something. But if the journalist doesn't bridge that gap, so that we will make sure that the end users have access to the right kind of information to make the right kind of decisions they need to make about
yeah.
their lives, then we are not making any progress.
I think that's a fantastic answer, and I think I'll temper that by saying respect and dignity to the local traditions and the local engagement as well is absolutely paramount in all of that. And I think that's obviously you're saying that as well, but I just underline that as well. So that's great, and thank you for that, Jessica, very much so, because I think it's very important to have that element in this mix of bringing these data streams together, really trying to achieve the same end. There was you mentioned the new novel technologies, and some part of my question was really how to drive sustainability in a way by giving not if employment is the right word or not, but total engagement at the community level. So I'm going to flip that to Anna, because a year ago I remember doing an ISNTD Connect session with Find about the biobank project, the virtual biobank project. I was shocked at how absolutely insane, what a beautiful idea, absolutely brilliant, and how you can engage people in the digital realm, and that's all going forward into a data repository, So firstly, have you got any more hats, any more rabbits in the hat to pull out? That was amazing. That session's on our website as well. We thoroughly enjoyed that. It was excellent. But other than that, engaging young people in these type of technologies, the digital landscape, is that a role for FIND?
Absolutely, I agree. Right now, we undergo through digital transformation internally. And, hearing some keywords such as community, champion, and all that, this is the same terms that we use internally, but I think they also apply externally to the community in general. And by giving opportunity for people to learn new tasks that they for sure will use later on in their life, either professionally or being, scientists of movements from civil and all that, it's definitely a good way to do that. And you mentioned before that I used R. R is an open source language. Everyone can learn R. Everyone can use the tools to create whatever they want. And community, I think, is the key element in all the answers that we're looking for. So if we engage, at the community level, but of course there will be a massive effort in many fronts, but we need to know the community specifics and the community needs, and then we can bring it further on into a, same consortium for data portal or whatever you name it. But yeah, we need to focus on the community.
That's a brilliant answer. And I would heartily recommend, I know it's me saying this, but we had such a brilliant session with Professor Paula Moraga. We named it ourselves, Adventures in R, Shiny and Beyond, right? And it was all about that, really. And that was about a year ago as well. That's on our website as well, on our Connect. And we got really into it in terms of the employment possibilities and basically cohesion. And just flipping that back to Austin for a second, we're talking about end users using an interface such as No Dengue, or moving it forward, or being so engaged with it that you don't ever have to worry about, are people using it? Is there something being generated out of it? It's self-sustaining, and that kind of thing, I think, is a really important kind of element in all these considerations. All I can say is I absolutely hope this results in some kind of thing, the consortium, as you mentioned, Anna, or something, because we put a lot of thought in our panels who we're going to invite, and it's not really as random as our haircuts suggest, or whatever. There is some thought behind it, there's some logic behind it, so we really hope this grows towards something positive. So that's what we can really add to that. I have been asked, to stepping away from dengue or arboviruses for a second, I have been asked to ask a question by Dr. Edwell Alpizar from the University of Glasgow, specifically to Anna. So I'm just going to honour that, and because he had to leave, so I'm going to ask you that. So he's asking, why is such a difference in the investment for Chagas disease relative to other NTDs? It's been considered a priority recently. Is that happening across other institutions as well? I know, for instance, the University of Dundee also prioritize it, or factors, i.e. the prevalence.
Actually, there's no difference in investment in terms, in FIND. It was just because there was a project in FIND that was funding a technology landscape, so we decided that we should invest in a technology landscape for Chagas. But at the same time, we thought that it would be a huge loss if we don't integrate that within a comprehensive NTDs portal. That's why we have open access for submissions for manufacturers of other tests for other NTDs, and this is why we are trying to motivate people, to be transparent and share their data through these submissions. Yeah.
That's a great answer. So there wasn't a political conspiracy?
No, whatsoever. It's the usual story.
I was thinking of the crosshairs moving across. All due respect, Dr. Alpizar. He's put his email there as well. He's at Durham, sorry. So that probably explained the question as well. And so in that sense, so he said that you'd appreciate if you could pass his email on, and if you could briefly email his person. I'm just honouring that. So it's there.
Definitely.
Yeah, well, that's very kind of you, and thank you very much for that. We're coming up to the end. We're over the end, and I've kind of cheekily gone over because we're having such a good conversation, and you all played really nicely and stayed there. So I really appreciate that. If that's okay, one last question, if that's okay with you. We mentioned, if that's it, funding, we mentioned LMIC settings, resource optimization, really, I guess you could call it, making the best out of what we have in front of us, right? When you're in this partnership mode, when you're in this kind of consortium mentality, who funds what? Who should be responsible? Where is this funding going to come from? You can't just say private sector. You can't just say one. It's got to be so. Where and how is that issue ever going to be resolved? Massive question. Sorry, but it's the end of the day. So, no, I was laughing. You know, it's a huge question. But come on.
Who takes the lead now? I don't know. We should.
We could just get poor Austin here because it is private sector, but I think it's an honest question, right? What about the funding of these things?
So rather than sort of we giving the ideas to potential funders, for example, now as you said, private sector already funding different initiatives, academia also involved in some of these initiatives. So rather than we giving them the ideas, why not we invite them to discuss with us the ideas? That is how we have approached. Actually, now, if you see now, the World Food Program is funding a program on dengue. So in that context, you can sort of link the lines. But we sort of address dengue in a very complex situation or a multi-hazard situation, so that these other agencies can also get involved in our projects, so that their expectations or the combined expectations of all the agencies are addressed. So that is the approach that we have been engaging, because that is how the real world works. I mean, the diseases and all the hazards around us, they are not compartmentalized, they are not siloed into different sectors. So a cohesive approach where we appreciate the mandate of other people and they appreciate our mandate. So that is the future path, I think.
That's a great answer. And thank you very much for that. Austin, if I'm just going to quickly go to you for the private sectors, you already, as just been pointed out by Lahiru, you're already financing lots of different projects in a multi kind of pronged approach, and a very commendable one at that, a very worthwhile one at that. What's your views on that? Oh, your volume, you have to put your, sorry, at the top. Yeah. Well,
yeah, I got it. Thank you. So from a private sector or a company perspective, we like working in partnerships, and partnerships are very important for each member to really think about what is the value proposition for those partnerships or those individual stakeholders within the partnership. And I think you can start to think around generally investments in different ways to achieve those stakeholder goals. It might not actually be dollars that is the driving force. It could be skill or competency exchange. It could be some other type of resource to go into the partnership as well. So there are different ways of looking, other than pure dollars, about generating benefit and value for each stakeholder within a partnership. And that's the way that we as Takeda team like to think.
And that's an excellent answer, because that kind of builds on what Lahiru just said as well. This multi-agency approach, because it's the nature, the integrated nature of this particular setting in dengue. You know, you've got social bonds, you've got absolutely different mechanisms, all sorts of different stuff going on that could be tapped into. So green corporate, the green carbon, the carbon credit. The biggest stock market on the planet is carbon credits. People forget that. It's bigger than the combined 4 stock markets that we have already. It's the carbon trading that's the biggest. Why are we not tapping into any of this? It's huge. So absolutely brilliant answer. That's brilliant. So all of this leads back to Anna. It's your fault. You had that slide. Started. You shouldn't have done that to us. That was it. I mean, I'll give you the last word on it because then I'm gonna get in trouble. So yeah.
You asked who pays for it, right? My answer would be let's ask Chat GPT because she might give us an answer. No kidding. I mean, I think we need to put in a good use the AI technology, right? Build models around it. Having this data coming into our data portal, we could build sort of data-driven approaches with composite indicators where the gaps are, who is financing what, and both sides can actually benefit from that. Because people that need funding can go and ask the model, who's funding this kind of project, and they can find an answer. And at the same time, funders can see where the gaps are, where the value will come from their investment, and actually fund accordingly.
That's a superb answer, because I love that the Chat GPT answer, because prior to this session, we had Professor Joachim Rakalev of the University of Heidelberg, and he'd just been to Sri Lanka actually, and he'd given some talks there in terms of predictive capacity, and he's actually using Chat GPT to analyze massive data sets and turn them into a visual representation. And we were discussing as part of that adding predictive capacity to apps and So that's a fantastic answer. It's topical. I think someone's going to do it. I think someone's going to and I think they should. So that's brilliant. I'm going to get in a lot of trouble if I stay on, because I'm being told it's the end and the room is going to implode and the whole thing. But it's been a wonderful day. I'd like to thank you from the heart, everybody involved in this particular panel. Excellent end to the day. Thank you, Austin. Thank you, Anna. Thank you, Larry. Thank you, Jagath. Thank you, Jessica, as well, as you're still with us. Thank you. And I hope you've all enjoyed the day. We're back tomorrow, for day 2. I think that was Jessica. And we're back tomorrow for day 2. It's going to be completely packed. And we're starting with schistosomosis in terms of the pediatric praziquantel consortium and their kind of approach to community. And then we're going into various sessions for the rest of the day, including a very interesting session, I think. So we have a partnership with something called SADC, which is the South African Development Consortium, 16 African countries youth parliament across 16 countries, right? And they have 2 clusters. One is the health cluster, right? So we have that person, the head of that. But then there's a new cluster called Pan-Africanism, Culture, Arts. And I'm going to be having a session to see how can we change narratives. How can we go full swing and change the narrative in terms of the communication modality that we're using? Is it the orphan with a cup? You know exactly what I'm saying. We need to change this mentality. How are we going to do that? Who are the heroes? Who are the people we look up to? And I'm sure data scientists are going to be number one in there, given what we've just talked about. When it's the truth. If we want to engage these communities, they need something to aim at. They need something to belong to. So we want to just look at this narrative tomorrow. We've got some very interesting stuff from Fiocruz in the afternoon. So the lab as an art place. So they've made Aedes aegypti eggs with washing, actual art, with washing labels. There's a researcher, Dr. Ross Dalziel. He's got old vinyl records, right? And they're turning those into microfluidics, and it's real. And so the Fiocruz Fine Arts Department are coming, and them and the healthcare teams are all coming together to see some absolutely mind-blowing actual art engagements with the communities. That's all tomorrow. All of today will be recorded, and we'll have that all up on our website very, very, very shortly. I'd like to say thank you very, very much from the heart. Thanks a lot. And and we hope.
Thank you.
Thank you again, Jessica, as well, and Austin as well, and everybody. And I hope you have a chance to have further ISNTD Connects in the future in terms of maybe we can. So not good at goodbyes, but I'll have to say goodbye. All right. Thanks a lot.
Bye.
Guys,
Thank
take care.
you.
Keep safe.
Bye.
Take care.
Bye.
Bye-bye. Bye-bye.